signs and symptoms of whooping cough in children is highly infectious disease of the respiratory tract caused by poultices and transmitted by airborne droplets, mainly paroxysmal coughing and whooping sound on inhalation. Young infants often present with apnea and cyanosis. It may cause gasping and apparent life-threatening event ALTE and decreased O2 death. It's treated by macrolide symptoms. It has 3 stages. First stage, control stage, 1 to 2 weeks, like upper respiratory infection, coryza, mild cough, and nasal discharge, and low-grade fever. And second stage, paroxysmal stage, 2 to 6 weeks, intense paroxysmal coughing, followed by deep and loud inhalation and whooping sound, struggling to breathe. Post-tussive vomiting may occur. Infants less than 6 months may only develop apnea. Third stage, convalescent stage, with 2 months reduction of symptoms with some coughing attacks. Classic pertussis is seen in children between 1 and 10 years old. The progression of the disease is divided into the controlled, paroxysmal, and convalescent stage. The control stage is marked by non-specific signs, increased nasal secretion, and low-grade fever lasting 1 to 2 weeks. The paroxysmal stage is the most distinctive stage of pertussis and lasts 2 to 4 months to 4 weeks. Coughs occurs in paroxysm during expiration. Expiration. Less severe infant may not display coughing. Occurs paroxysm during expiration, causing young children to lose their breath. The first one, inhalation against the narrow glottis that follows this paroxysmal cough produces the characteristic whoop. The convalescent stage is marked by gradual resolution of symptoms over 1 to 2 weeks. Coughing becomes less severe. Infants may not display the classic findings, and the first sign in the neonate may be apnea. Young infants are unlikely to have the classic whoop, more likely to have central nervous system damage as a result of hypoxia. Whooping cough, also known as pertussis, is highly contagious respiratory infection caused by the bacterium Moldetella pertussis. It's known for severe coughing fits, followed by whooping sound when the person breathes in. The disease can affect people of all ages, but is most severe in infants and young children. The course of whooping cough can be divided into 3 stages. Control stage, 1 to 2 weeks, mild fever, low-grade fever is most common, runny nose, nasal congestion, and rhinorrhea. A mild cough. Initially, the cough is mild and can be mistaken for a common cold. Sneezing, frequent sneezing episodes, tiredness, general malaise, and fatigue. Paroxysmal stage, 1 to 6 weeks or longer. Severe coughing fits, intense bouts of coughing that can last for severe minutes. There are often uncontrollable whooping sound. A high-pitched whoop sound may be heard when the child gasps for air after a coughing fit. Now note that this classic whooping sound may not be present in all cases, especially in very young infants. Post-tussive vomiting following coughing fits due to the severity of the cough. Apnea in children. In infants, coughing may be minimal or absent, but apnea processed in breathing can occur. Facial cyanosis, the face may turn red or purple during coughing fits. And in severe cases, cyanosis bleaching to the skin due to the lack of oxygen can occur. Exhaustion, the severe coughing fits can leave the child extremely tired. Convalescent stage, with 2 months gradual recovery, the severity of coughing fits decreases over time. Persistent cough, a cough may persist for several weeks or even months, gradually becomes lasting. Complication of whooping cough can be severe, especially in infants, and may include pneumonia, seizures, brain damage, and in rare cases, death. Early detection and treatment with antibiotics can help reduce the severity of symptoms and prevent the spread of the strep disease. Vaccination is the most effective way to prevent whooping cough. The vaccine available for infants, children, and others due to earning immunity. Booster shots are recommended for older children and adults, especially those in close contact with young infants. So let's some of signs and symptoms of whooping cough in children. It's highly infectious disease of respiratory tract caused by pertussis and transmitted by airborne droplets. Paroxysmal coughing, whooping sound on inhalation, present with apnea and cyanosis. life-threatening event critical to death is treated by our life as during stages, control stage 1 to 2 weeks, like upper respiratory infection, charism, another discharge and lower grade fever. Second stage, paroxysmal stage, 2 to 6 weeks, intense paroxysmal coughing followed by deep and loud inhalation or in sound struggling to breath. Post-to-sleep vomiting may occur in infants. Less than 6 months may only develop apnea. Third stage, convalescent stage, week to months. Reduction of symptoms with some coughing attacks. Classic post-to-sleep is seen in children between 1 to 10 years old. The progression of the disease is divided into control, paroxysmal, and non-convalescent and convalescent stages. The control stage is marked by non-specific signs, increased nasal secretion, and low-grade fever lasting 1 to 2 weeks. The paroxysmal stage is the most distinctive stage of bronchitis and lasting 2 to 4 weeks. Coughing occurs in paroxysm during expiration, causing young children to lose their breath. Peripheral inhalation against the nose and glottis that follows the paroxysmal cough produces the characteristics. The convalescent stage is marked by gradual resolution up until over 1 to 2 weeks. Coughing became less severe. Infants may not display the classic findings, and the first sign in the neonate may be in young infants are unlikely to have classic cough, more likely to have central nervous system damage as a result of hypoxia. Mild control stage 1 to 2 weeks, mild fever, runny nose, mild cough, sneezing, paleness, and paroxysmal stage 1 to 6 weeks or longer, severe coughing fit, coughing sound, post-to-sleep, vomiting, apnea, facial cyanosis, exhaustion, convalescent stage, gradual recovery, persistent cough. Pneumonia, seizure, brain damage, rare cases that only detection and treatment can help them reduce the severe